What are 9 signs of metabolic syndrome after 40s? Metabolic syndrome is a cluster of conditions that occur together and increase the risk of developing heart disease, stroke, and type 2 diabetes. While metabolic syndrome can affect people of all ages, it is more commonly diagnosed in individuals over the age of 40. One of the most concerning aspects of metabolic syndrome is that it often goes undiagnosed, as many people do not experience any symptoms until significant damage has already occurred. In this video, we will take a look at 9 signs of metabolic syndrome after 40s. We will discuss each symptom in detail, including its causes, symptoms, and management options. By increasing awareness of the signs and symptoms of metabolic syndrome, individuals can take proactive steps to manage their condition and reduce their risk of developing serious health complications. Number 9. High blood pressure. High blood pressure, also known as hypertension, is a condition in which the force of the blood against the walls of the arteries is consistently too high. Blood pressure is measured in millimeters of mercury and is recorded as 2 numbers. The systolic pressure, which is the pressure when the heart beats, and the diastolic pressure, which is the pressure when the heart is at rest between beats. A blood pressure reading of 140 to 90 millimeters of mercury or higher is considered high. High blood pressure is a common symptom of metabolic syndrome, as excess body fat and insulin resistance can increase the amount of pressure that the blood puts on the walls of the arteries. High blood pressure can also be caused by other factors such as genetics, age, stress, and a sedentary lifestyle. If left untreated, high blood pressure can damage the arteries and increase the risk of developing serious health problems, such as heart disease, stroke, kidney disease, and vision loss. In fact, high blood pressure is often called the silent killer because it usually has no symptoms until it has caused significant damage to the body. Fortunately, high blood pressure can often be managed through lifestyle changes and/or medication. Lifestyle changes can help lower blood pressure include maintaining a healthy weight, eating a diet that is low in sodium and rich in fruits, vegetables, and whole grains, engaging in regular physical activity, limiting alcohol consumption, and managing stress. In some cases, medication may also be necessary to manage high blood pressure. There are many types of blood pressure medications available, and your healthcare provider can help you determine which type is best for you based on your individual needs and health history. Number 8. High blood sugar. High blood sugar, also known as hyperglycemia, is another common symptom of metabolic syndrome. It occurs when your body is unable to effectively regulate the amount of glucose in your blood. Over time, high blood sugar can damage your organs and increase your risk of developing diabetes. The American Diabetes Association defines high blood sugar as a fasting blood glucose level of 100 mg per dl or higher. If you have high blood sugar, it's important to take steps to manage it, such as making lifestyle changes and taking medication if necessary. Number 7. Excess body fat around the waist. Excess body fat around the waist is another common symptom of metabolic syndrome. It occurs when you have a high waist circumference, which is a measure of the amount of fat around your waist. Excess body fat around the waist is a risk factor of heart disease, stroke, and diabetes. The National Heart, Lung, and Blood Institute defines a high waist circumference as more than 40 inches for men and more than 35 inches for women. If you have excess body fat around the waist, it is important to take steps to manage it, such as making lifestyle changes, such as engaging in regular exercise and eating a healthy diet. Number 6. Abnormal cholesterol levels. Abnormal cholesterol levels are another common symptom of metabolic syndrome. This can include high levels of LDL cholesterol, which is commonly referred to as bad cholesterol, and low levels of HDL cholesterol, which is commonly referred to as good cholesterol. When your cholesterol levels are abnormal, it can increase your risk of developing heart disease and stroke. The American Heart Association recommends that adults get their cholesterol levels checked at least once every 4 to 6 years, or more often if they have risk factors of heart disease. Number 5. Insulin resistance. Insulin resistance is a condition in which your body is unable to effectively use insulin, a hormone that helps your body process glucose from the food you eat. When you have insulin resistance, your body may need to produce more insulin than normal to keep your blood sugar levels stable. Over time, this can lead to high blood sugar and an increased risk of developing diabetes. Insulin resistance can also increase your risk of developing other health problems such as high blood pressure and heart disease. Number 4. Inflammation. Inflammation is a normal response of your body's immune system to injury or infection. However, chronic inflammation can be a symptom of metabolic syndrome. Chronic inflammation can also contribute to other health problems such as arthritis, asthma, and certain types of cancer. This is because metabolic syndrome can increase your body's production of inflammatory molecules, which can damage your organs and increase your risk of developing heart disease, stroke, and diabetes. Number 3. Sleep apnea. Sleep apnea is a sleep disorder in which breathing repeatedly stops and starts during sleep. It is a common symptom of metabolic syndrome, as excess body fat around the neck and throat can obstruct the airway during sleep. Sleep apnea can lead to daytime fatigue, high blood pressure, and an increased risk of developing heart disease and stroke. The most common type of sleep apnea is obstructive sleep apnea, which occurs when the muscles in the back of the throat fail to keep the airway open during sleep. This can result in loud snoring, gasping, choking sounds during sleep, as well as the symptoms of daytime sleepiness, difficulty concentrating or focusing, headaches, irritability or mood changes, dry mouth or sore throat upon waking, and frequent urination at night. If you are experiencing any of these symptoms, it is important to talk to your healthcare provider. They can help determine the underlying cause of your sleep apnea and develop a plan for managing your condition. Number 2. Erectile dysfunction. Erectile dysfunction is a condition in which a man is unable to achieve or maintain an erection that is firm enough for sexual activity. ED can be a symptom of metabolic syndrome, as insulin resistance and other factors can contribute to reduced blood flow to the penis, making it difficult to achieve or maintain an erection. ED can have a significant impact on men's quality of life and can also be a sign of underlying health problems such as heart disease or diabetes. Some of the most common symptoms of ED include difficulty achieving or maintaining an erection, reduced sexual desire, premature ejaculation, delayed ejaculation, and anorgasmia. If you are experiencing any of these symptoms, it is important to talk to your healthcare provider. They can help determine the underlying cause of your ED and develop a plan for managing your condition. Number 1. Non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is a condition in which excess fat accumulates in the liver of people who do not consume significant amounts of alcohol. NAFLD is a common symptom of metabolic syndrome, as insulin resistance can lead to an accumulation of fat in the liver. NAFLD typically develops gradually over time and may not cause any symptoms in the early stages. However, as the condition progresses, it can cause a variety of symptoms and complications, including fatigue, pain, or discomfort in the upper right abdomen, enlarged liver, liver inflammation, scarring of the liver, liver cancer. NAFLD is diagnosed through a combination of blood tests, imaging tests, and liver biopsies. Treatment for NAFLD typically involves lifestyle changes aimed at reducing the accumulation of fat in the liver. Losing as little as 5% to 10% of body weight can help reduce the amount of fat in the liver. Eating a diet that is low in saturated and trans fats, high in fiber, and rich in fruits and vegetables can help reduce the amount of fat in the liver. Engaging in at least 30 minutes of moderate physical activity on most days of the week can help reduce the amount of fat in the liver and improve insulin sensitivity. Managing underlying conditions such as diabetes, high blood pressure, and high cholesterol can help reduce the risk of complications from NAFLD. And with that being said, it's time to end our video. Subscribe to the channel for more amazing videos like this. We'll see you with another interesting video.